Welcome back, Straight Talkers. Today I'm going to talk about the diagnosis, postpartum depression, and how psychiatrists go about making this diagnosis clinically. But first, make sure you hit that subscribe button so that you can be the first to know when new content comes out. It is estimated that between 3 to 6% of women will experience the onset of a major depressive episode during pregnancy, or even the weeks or months following delivery. And something that many people don't realize is that around 50% of postpartum major depressive episodes actually start to begin prior to delivery. Therefore, we typically use the term peripartum in the medical field when talking about this diagnosis instead of postpartum. Postpartum depression, which is also known as major depressive disorder with peripartum onset, is given if the onset of mood symptoms occurs during pregnancy or in the 4 weeks following the delivery. Research studies have shown that mood and anxiety symptoms during pregnancy, as well as the baby blues, increases the risk for a postpartum major depressive episode. And this is why extra attention is given to moms who experience these symptoms so that we can catch and treat symptoms sooner rather than later if they were to pop up. Now let's dive into the various signs and symptoms that psychiatrists will screen for. When evaluating for major depressive disorder, there are 5 criteria that need to be taken into consideration, and these are listed from criteria A to E in the DSM-5. Criterion A is the longest and states that 5 or more of the following 9 symptoms need to be present during the same 2-week period and represent a change from previous functioning. So these symptoms can include 1. Depressed mood most of the day, nearly every day. And this can be either subjective reports of someone stating that they feel sad, empty, or hopeless. Or, it could be directly observed by others around you. Many spouses will tell me that mom is more tearful than usual and spending a good chunk of the day crying. Number 2, markedly diminished interest or pleasure in all or almost all activities, most of the day and nearly every day. And you may have heard doctors talk about the term anhedonia. And this is what anhedonia is referring to, It's that loss of pleasure in hobbies or activities that are typically most enjoyable for you. 3 is significant unintentional weight loss or weight gain, or decreased or increased appetite. Number 4 is insomnia or hypersomnia nearly every day. Number 5 is psychomotor agitation or psychomotor slowing, and this again needs to occur nearly every day. And this needs to be observable by other people, and it can't just be a subjective feeling of restlessness or feeling slowed down. Number 6 is fatigue or loss of energy nearly every day. Number 7 are feelings of worthlessness or excessive or inappropriate guilt nearly every day. 8 is diminished ability to think or concentrate, or even indecisiveness that occurs nearly every day. And number 9 is recurrent thoughts of death, recurrent suicidal ideation without a specific plan, a suicide attempt, or a specific plan for committing suicide. As mentioned before, 5 of these 9 symptoms need to be present. In addition, 1 of the 5 symptoms needs to be either depressed mood or loss of interest or pleasure in activities. And if the various requirements for criterion A are met, then I'll then screen for criteria B through E. Criterion B states that the symptoms need to cause clinically significant distress or impairment in one's social, occupational, or other important areas of functioning. Criterion C states that the episode is not attributable to the physiological effects of a substance, such as alcohol, drugs, or medications, and the symptoms cannot be attributable to another medical condition. Criterion D says that the occurrence of major depressive episode is not better explained by schizoaffective disorder, schizophrenia, schizophreniform, delusional disorder, or other specified and unspecified schizophrenia spectrum and other psychotic disorders. Lastly, criterion E states that there has never been a manic or hypomanic episode. It's important to recognize that peripartum onset mood episodes can present either with or without psychotic features, and it's estimated that these can occur in anywhere between 1 in 500 and 1 in 1,000 deliveries. It's believed that the risk for psychotic features is more common with first-time moms, those who have had prior postpartum mood disorders, and those with a family history of bipolar disorder. The most common symptoms of psychosis that you've probably heard about in the media have been reports of moms who have command hallucinations to harm their babies, or delusions that their babies are possessed. But it's important to realize that not all hallucinations and delusions present in this way, and they can be variable based on the individual. Once someone has experienced a postpartum episode with psychotic features, The risk of these symptoms coming back with future deliveries is anywhere between 30 to 50%. Therefore, we give extra attention and care to those moms if they were to become pregnant again to help reduce the risk of these symptoms. If you have concerns that you are struggling with these various signs and symptoms, please do not hesitate to reach out and to make an appointment with your primary care physician, OBGYN, or psychiatrist to get further evaluated. Thanks for watching this video. Now head on over to the next one so that you can find out more ways to live your best life.